Good evening, everyone, and thank you so much for coming this evening. My name is Dr. Ashley Williams. I am a board-certified internal medicine physician working in the Adult and Family Medicine Department here at Capitol Hill Medical Center. I am joined today by my incredible colleagues here on the panel, Dr. Keith Egan, Dr. Michael Horberg, Dr. Cabell Jonas, and Bianca Ray. We are honored to be joined by Japer Bowles, Director of DC Mayor's LGBTQ Affairs Office, and Mr. Charles DeSantis, Associate Vice President of Faculty and Staff Benefit, Chief Benefit Officer at Georgetown University. Got that all right, good. All right. So we are very excited to be speaking with you today about the importance of LGBTQ plus healthcare and share the exciting work happening at Kaiser Permanente Pride Medical. So we're going to start with some brief introductions and we'll just go down the row. So we'll start with Dr. Egan.
Good evening. Thank you all for joining us today. I'm Keith Egan. I'm a board-certified family medicine provider, and I am one of the physicians who helped to found the Pride Medical Center, along with Dr. Horberg and Dr. Emanuel, who will be joining us in the audience later today, and Dr. Stephanie Letourneau, who is not able to join us here. But I'm the Associate Medical Lead for the Gender Pathways Program in Pride Medical, and a primary care physician here.
Hi, I'm Dr. Michael Horberg, Associate Medical Director here with our Mid-Atlantic Permanente Medical Group. One of my areas of responsibility is, in fact, the areas of LGBTQ health and also leading HIV and STDs for KP nationally. And I'm so proud to be part of not only the LGBTQ community, but also part of Pride Medical's founding.
Hi, I'm Cabell Jonas, and I'm a research scientist and the Director of Research Programs with the Mid-Atlantic Permanente Research Institute, and I support the Pride Medical Program and the Gender Pathways Program.
Good evening, everyone. My name is Japer Bowles. My pronouns are he, him, his, and I'm the Director of the Mayor's Office of LGBTQ Affairs in the Mayor Muriel Bowser administration. I'm really honored to be here tonight and to support such healthcare facilities and more resources for our LGBTQ plus community. Thanks.
Hi, everybody. My name is Bianca Ray. My pronouns are she, her, hers, and I'm with our Equity, Inclusion, and Diversity team here in Kaiser Permanente Mid-Atlantic States as the Business Resource Group liaison, and I am also part of our KP Pride Business Resource Group. So happy to be here.
Good evening. I'm Charles DeSantis. I'm the Chief Benefits Officer and Associate VP for Benefits and Wellness at Georgetown. I am part of the LGBTQ community and have been at Georgetown for 17 years. My husband and I live in Chevy Chase, DC with our 4 kids. So I'm really happy to be here. I love Kaiser. I love this whole approach, and I'm so glad to be able to be here tonight.
Thank you all, and we are so thankful for you all coming here tonight to participate on our panel. So we'll get started with a few questions. We'll start with you, Dr. Egan. Can you speak a bit about why it is important to have an inclusive, specialized healthcare, and a bit about Pride Medical and how it offers specialized care?
Definitely. So I think the most important factor that led us to develop Pride Medical, and one of the biggest benefits to the patients that we have, is creating a space where patients can know going when they step in the door and set up the appointment that they're going to be greeted in a comfortable environment and have a physician who is experienced working with the community. I know as a gay man myself how terrifying it can be to set up an appointment and be constantly thinking in the back of your head, you know, when I go into this office and I'm sitting there in front of this physician, is this provider going to relate to the experiences that I'm talking about? Are they experienced working with the LGBTQ plus community? And what we've created with Pride Medical is a way that patients can identify from the start that safe space so that they can come in. So I think that trust and that comfort are the biggest benefit of Pride Medical. But we also just have providers who have an amazing amount of experience in doing things like providing pre-exposure prophylaxis for HIV, post-exposure prophylaxis, talking about sexual health, and with transgender healthcare. So with our Gender Pathways program, we have providers like Stephanie Letourneau, who's been working for 15 years providing primary care for transgender patients, and Dr. Emmanuel, who has been providing OBGYN services for the transgender community, including pre- and post-surgical visits, and has been doing some surgeries himself. So the experience that we have it really kind of follows through after the patients come in the door and allows that comfortable environment to serve the needs of the patients that are coming in.
Thank you, Dr. Egan. And I think it's so great that not only are we located here at Capitol Hill, but we also have access virtually for our members who can't make it all the way here. Can you talk a little bit about that?
So since we serve such a wide region, we have patients all the way up in Baltimore and down in Virginia, and the virtual visits that we've had have been able to allow us to serve patients throughout the entire community. That was helpful even for patients here in DC during the worst of COVID, when patients weren't necessarily comfortable coming into the medical center, but also for patients who would have had to drive or take public transportation for hours or more so that they can access us through a video visit. We can do that initial meet and greet and then decide, does the patient need to come in for an in-person visit, or can we do this virtually? If we order labs, we can have them go to a center, a Kaiser Permanente center that's more convenient for them, get radiology there or whatever else might need to be done. And so having those video visits has really been able to expand our access to the whole region.
That's great. And you mentioned how the excellent care starts at the door, and we have some lovely photos here of our beautiful lobby that your team has worked so hard on making such a great space. We even have a couple of the artists here in the audience, so that's really great. Can you talk a little bit about that?
We were so lucky to be able to get these pieces from local artists who identify with the community, and they really kind of speak to the breadth of services and the diversity in the community that we're serving. And so I hope that you can check out the pieces through the video here, and at some point come up and visit the waiting room in person, because it really brightens it up and creates this warm and inviting environment. And we've been able to put little plaques next to each of the pieces to kind of, in the artist's own words, explain what the piece means to them, and make sure that we give credit to the artists.
Thank you. Okay, Dr. Horberg, can you talk about conditions that are more likely to impact people in the LGBTQ plus community?
You know, it's not, some of these conditions aren't necessarily more in the LGBTQ community, but there's a comfort level of being able to talk about sexual health, talk about primary care with a physician who understands where you're coming from years of, whether it be internalized or externalized homophobia or transphobia. There's a comfort level to have a physician that you can talk to, and you don't have to couch your terms to talk to them. But there are some conditions that we purposely want to call out. One, of course, is when our members are going on the gender pathway. There's important things. There's some certain things related to medications, drug interactions, even prescribing the right medications and getting them to the right surgeons if they want to go down that part of the pathway. We also have to. There are new ways of self-expression, including the non-binary community, the gender diverse and gender fluid community, and people go through their lives, they go through different pathways. So it's really important that we have communities that physicians who can help them with that, and of course, a caring staff. Other things that we would want to pay particular attention is, of course, to substance use, also screening appropriately for STDs, talking about PrEP, pre-exposure prophylaxis. If someone comes in impacted by HIV, we want to make sure that we get them within the system working well and with physicians who can care for them. And of course, other areas of good obstetrical health, gynecological health, and of course, urologic health.
Thank you, Dr. Horberg. And it's great that we're starting the conversation about PrEP, not just waiting for someone to ask us about it. And I think that's another amazing thing about our clinic and the providers within it. Can you talk to us about the increase in STIs in the LGBTQ+ community in our area?
So it's very interesting. I've been practicing medicine since 1980. And initially, when I started, and I was initially in private practice in Chicago, my patients, my friends were dying of HIV. And of course, we got more involved in getting access to new medications. And then 1996 came around with the advent of the cocktail. And there was a certain amount of released freedom. And what we know is U equals U, undetectable equals untransmittable, of HIV. But that also, though, however, still doesn't treat the other STDs, whether it be syphilis, whether it be gonorrhea, chlamydia, and including gonorrhea and chlamydia in sites of the body that aren't typically screened for, non-genital, like anal and pharyngeal. So we're able to also help them with that. And now, of course, there's a large increase of becoming epidemic levels of syphilis. And in the last year, let's not forget monkeypox. And so to also be able to, in Pride Medical, we were able to, through the work of our colleagues, especially let me call out Dr. Gahunya, we were able to get a monkeypox vaccine from the district available to be given to our patients within Pride Medical. And that was the first location within Kaiser Permanente itself that we were able to give that vaccination. And of course, through one of our other colleagues, Dr. Peter Kadlachek, we were also able to get access to TPOXX, the CDC-controlled medication. We were really one of the first in the district to get that access to that medication. So having it all in one roof, one-stop shop, also really improves the care.
Yes, it's really been amazing watching how your team has advocated to make sure that we are able to internalize care and provide it for our members. It's just amazing. Thank you. All right, Dr. Jonas, can you speak about how Kaiser Permanente Mid-Atlantic States is using research to improve clinical care for our LGBTQ+ members?
Sure. So both Pride Medical and Gender Pathways were designed based on research done by one of my colleagues, Suma Vupatori, and a team of colleagues in the Mid-Atlantic Permanente Research Institute. So they had conducted some research just looking at ways to improve care for LGBTQ patients. And we took the learnings from that research and specifically used them to design both of these programs. So trying to close gaps in care, trying to improve service, trying to improve patient experience, trying to make the experience smoother, so taking away unnecessary steps and administrative pieces. And so we really, used the research to inform the programs, but in turn, we are now looking at our programs and studying them from a quality, performance, patient experience perspective, and we will infuse that back into the literature to be able to share our own experience with other organizations looking to improve health. So really, one of the goals of having embedded research within a medical group is being able to, more rapidly apply research findings from the literature into our care, and then being able to study our care and reapply that back into the literature for others to learn from. So, again, it's just the power of the organization and really having the opportunity to infuse research into these programs and improve health for the LGBTQ patients.
Great. Thank you, Dr. Jonas. Driving up the value by improving our quality and our member satisfaction and driving down the costs. All about Kaiser Permanente here. Love it. All right. So, Charles, can you talk about the importance of coming out to your physician? Do you have any advice for allies or people who don't identify as LGBTQ+ but want to help support this community?
Well, when I was asked that question, I had to think about it because I'm a gay man of a certain age, and in the 80s, being raised in San Francisco, you needed to tell your doctor that you were LGBTQ, right? It was important, and it didn't always feel safe and non-judgmental and transparent, right? You were forced into it, and now I think, as we've evolved to the degree that we have in some arenas, it's a place you can go for a place of non-judgment and a place of safety and a place of clarity. So when you're getting the care that you need, your physician is your safe space and is a place you get to be supported holistically. And that I think still doesn't exist for everybody, right? It pretty clearly doesn't exist for people. And, you know, I have been at Georgetown for a long time. I'm in my 17th year at Georgetown. And when I moved to DC in 2006, we were having some experiences with some bias incidents with LGBTQ, and our president was like, we're going to actually create a place for inclusion and safety. And, you know, being from San Francisco, I didn't necessarily get that because I was kind of in that safe space, or I felt I was. And then as we peeled that onion, I realized how much we needed it, which is the way I feel about getting care and having that relationship with your doctor. So for me, that it's really important place of safety and non-judgment and you know, transparency about who you are. So when you're being treated, the whole picture's there. I think that, you know, was mentioned earlier that you needed to share certain data to be treated a certain way. It was important, and that still exists today. But I also think for allies, I think it's accepting people for who they are and letting people show up and be present for who they are and meeting them where they're at, being who they are on their journey. And some places in our nation that works pretty well, and some places it doesn't. And some places that we think it doesn't always do that holistically. So when you're going to get your care, one of the most personal things for yourself is to care for self so you can support others. You need to know that it's a safe place. I also want to put a little plug in for Kaiser. So I'm from San Francisco. My first adult experience in healthcare was 19 and being seen on Geary Street in San Francisco and calling my mom to tell her, have you been to Kaiser? And she's like, why are you at Kaiser? I'm like, oh, I'm sick, but I'm fine. Have you seen this place? And she's like, it's a hospital. I'm like, well, I'm from Oak Knoll Naval Hospital. This is like Taj Mahal. So I just love how wonderful this environment is. I love Pride Medical, and being able to provide this for our faculty and staff for the last 17 years, actually last 45 years has been great. So, but back to the question. My husband and I have 4 children, and creating safety and a place for them to be is very important. And when you feel safe, they feel safe. And when you feel cared for, they feel cared for. And they know the minute especially we have all the same primary care physicians, so they kind of have that connection. But that's a wonderful experience, and I'd want everybody to have that.
Thank you. And thank you for being a member. And we love for people to brag on us because this is a great place to receive care. So thank you for that. Okay, Bianca, can you speak to the importance of accessing gender-affirming transgender healthcare and how that has impacted you personally?
Thank you. I think before I get into my own personal story and kind of sharing what my experience has been navigating through the healthcare system, I think it's also important to kind of share, you know, some of the data which connects to kind of, you know, the question. For many of you who may know or may not know, in 2015, National Center for Transgender Equality did a survey targeting our trans and non-binary community across the United States and in Puerto Rico and in Guam. And through that survey that was done, there was a lot of data that really not only uplifted the voices of the trans and the non-binary community, but also made visible all of the challenges and the gaps that are within this community. So to kind of share some of those data, right, because I think it answers the question. In 2015, when the survey was given or acted upon, there was about 27,000 people who have responded to that survey across the United States and outside of the United States. Of those 27,000 individuals who identify as trans and non-binary, 30% of those respondents who saw a healthcare physician or a healthcare team had at least one negative experience related to being trans, one of them being verbally harassed or refused treatment because of their gender identity. In addition to that, 23% of respondents reported that they did not seek the health care that they needed due to fear of being mistreated, right? So which is really critical when we're thinking about like how do we engage this community into our healthcare system. And then lastly, 33% of the respondents did not go to a healthcare physician or healthcare team when needed because they can't afford it. Right? So when we're thinking about not just the access, there's also the conversation around them getting into our facility, right? So I think to answer your question, part of the reason why I share this is, for organizations such as Kaiser Permanente and other healthcare organizations to kind of help reduce those numbers, right? And to ensure that when our members and our community come to our facility, that not only they're living their authentic self, but they're also getting the care that's more individualized. To my personal experiences, and this might be a little biased because I'm a Kaiser employee and I use our healthcare system, but I've heard this from other members of the community as well. I think it's critical to, one, being able to really talk authentically to your primary care physician on the care that you need. And I think that's what's most important for me. Without going into any details, I've had, major health scare 7 years ago that, may or may not impacted on my transition journey. As a transgender woman, you go through this transition journey that also have a lot of other health risks, and in addition to kind of the positive outcome of that. So what my experience has been with my primary care physician now is not only prioritizing my mental health and my ability to be myself and live my authentic self in all of those transition journey that I have, but also taking care and making sure that my overall health is also in place, right? And I think having physicians like I have, like Dr. Egan, Dr. Horberg, Dr. Emmanuel, and everybody in the Pride Medical, and having not only that skills and that experience, but just being really more understanding of the community, not only helps from the experience of that member, but also from their overall health, right? So I think for me personally, I recognize that I have a certain privilege of navigating the healthcare system being part of Kaiser Permanente and as an employee of Kaiser Permanente. And I'm always going to be forever grateful for that. But having said all of that, there's still a lot of challenges that we're seeing, not only for Kaiser Permanente, but in the healthcare system, right? But having Pride Medical and having healthcare team and healthcare physicians who not only have the skills and the experience to take care of these members, but being part of the community or have an understanding of the community is helpful just from a mental capacity or a mental state of that individual. I've certainly had my experiences where from the parking lot to where I needed to be, I'm constantly thinking of are they gonna recognize me? Are they gonna notice that I'm trans? Are they gonna say something to me in the elevator? And those things affect how your overall visit and your overall health in general, because these are some of the things that many of us, don't think about, but for somebody like me, who identify as trans, I constantly have to think of all of these things in addition to really what's needed for my transition journey and for my health. So I think, having Pride Medical definitely helps the community and the members that we have to eliminate some of those little things that they think about just to get from one place into their doctor to see their doctor. And then it also it builds trusts and partnership where they're able to really talk more openly to their physician, not only for their transition journey, whatever that may be, but also for other reasons outside of those journey. And I appreciated the fact that the care is individualized. Trans people and non-binary people do not transition the same. We all have our own individual journey that we go through that are personal to us. And I appreciated that the conversation like that with Pride Medical and the people that are engaged in these conversations really listen to kind of give you the proper care that you need in order for you to continue to live your authentic self.
Wow. And thank you for sharing those statistics with us. That's very powerful. I'm glad that you've had an amazing experience, but I'm also very thankful that we try to give that experience to all of our members, not just those that work with us. Even things such as embedding in our Health Connect system, which is our medical record, making sure that we're using proper pronouns and naming people how they want to be named, which came in effect maybe 4 or 5 years ago. I'm not sure of the timing, but it's just the small things like that, trying to provide equitable, empathetic care to all of our members, and preventative care. We're very big on that. Okay, thank you. All right, Japer, can you speak about the importance of government support leadership in order for LGBTQ plus populations to receive necessary medical care?
Yeah, absolutely. So first off, thank you for having me, and thank you, Bianca, for sharing your story. That's really what it's all about. I grew up in Missouri, and we did not necessarily have affirming care. And one of the only spaces that a queer person or member of the LGBTQ plus community can speak or feels like they do have an opportunity to speak, at least in my hometown, was Planned Parenthood and these other safe spaces. And doctors really were the safe spaces. And looking at that now, all across the country, when we have politicians who are fighting and attacking LGBTQ youth and trans youth, these small hubs or large hubs, in these rural areas, they really do provide critical services, and not just the services, but also the space, the confidentiality to say, this is who I am. And that bond is something that a lot of youth really need, and it's really exciting to see KP and so many other organizations being proactive about it and having a space and leaning into it. Because yes, we do have something here in DC, but you have locations all across the country, and queer kids see, in DC and in a few other cities, there are dedicated resources for you, and that it just means so much. It really does. It means people's lives. Honestly, especially in our LGBTQ youth. I will say, living in the nation's capital, we pride ourselves on being one of the queerest, highest density populations of LGBTQ plus people in the nation, and it is very fitting that we do have a center as such here, not just because we have such a large population, but it kind of feeds the cycle, like queer people want to move to where they feel comfortable, and more spaces open up because more queer people live there. And I do want to say, as the politician at the table, it is kind of scary, because I feel like we are creating these bubbles where there's complete safe spaces, and just across the border, Virginia, it's not the same. So borders mean a lot, but they also don't mean anything, especially for this movement, this field of work. People move. So there's a lot of hope here, especially in this room and this resource. I would just say what we need to continue to do is to continue to advocate, not just locally, but nationally. I have to plug DC statehood, DC statehood, DC statehood. So we do have more emphasis on what the nation is doing, because we know what we're doing in this city for our LGBTQ plus youth and adults and seniors are really advanced, and we're leading the nation, and there's so much an opportunity to share those resources with other jurisdictions. So we really, really need to continue to keep pushing nationally for sure. And there's great examples that we can use locally from not just DC, but Boston's doing a lot of great things. LA's doing a lot of great things. New York City is as well. And it's a good opportunity to extrapolate and move those to things to Southwest Missouri to provide those resources.
Okay. Thank you, Japer. Southwest Missouri sounds like a great place. We like it here a lot. We're so thankful to have the support of the mayor's office and you here today. If there's one small thing you could tell any one of us out here today to do that we could do to spread the word or extrapolate what we have here? What's one small thing we could do?
Use pronouns. I know it sounds so silly, but for a youth that has no idea what they're trying to lean into, it's just a really simple way to say, like, hey, I got you. You don't have to say, like, all this other stuff. If you say what your pronouns are, that person knows, like, you're an ally. I can talk to you.
Great. All right. Okay, well, thank you, panel. Now we're going to open it up to the audience, see if there's any questions. Okay, then we'll go back to Dr. Egan. Oh, there's one? Okay. Okay, well, while we're waiting for the transition, we'll ask Dr. Egan one more question. Can you share patient feedback on Pride Medical so far and where we see Pride Medical and gender pathways expanding and changing in the future?
Certainly. We have received tremendously positive feedback from our patients since we've opened up. I receive that in the exam room from patients every Pride Medical session that I have. When I have patients come in and say, I'm so happy that I was able to find you. I'm so happy that you have this program. And then having patients say, I need to share something with you that I've never shared with anyone before, or I've never felt comfortable sharing in a medical office before. And those moments are so powerful and really why we created the program. And so we've been very lucky to have all of that anecdotal positive evidence, positive feedback. But in surveys that we've sent out to patients, we've gotten tremendous feedback as well, kind of overwhelmingly positive experiences. And we certainly are taking the feedback and trying to continue to improve the program.
Great.
Is there a second part to that question?
Expanding in the future.
So we're hoping to continue to be able to use the video visits like we were talking about before, to add some more video visits to be able to serve members who aren't able to make it here to Capitol Hill. And hopefully as the program grows, we'll add more and more visits for access for patients, kind of expand into allowing services for adolescents. And I'm excited to see where it goes as we go into the next few years.
Yes, very exciting. Okay, did we get the mic? Okay, great.
All right. Good evening, everyone. My name's Les Henderson, and this is my partner, Kristen. I have a support space for LGBTQIA plus people experiencing chronic illnesses, which formed with my challenges of endometriosis. And you all have touched on this, and I want to first congratulate you and thank you all for creating this space. It's very needed. But you all have touched on expansion, and after some experiences that we've experienced, in fact, Bianca, you probably don't remember, but I had reached out to you earlier in the year with an experience that we had at the Marlow Heights location. So I wanted to know about plans to have in-person this in-person at the other branches, because while this is great and is very centralized, transit accessible, so many people of the LGBTQIA plus population do live outside of the downtown core. We can get here, but we are closer to other locations, and so are other people in the within the community. And what we've experienced, like here, it's been great, but it's been other places, like some experiences we had at Marlow Heights, and then an experience I had at the Largo location that was definitely less than stellar, and I wouldn't want anyone to experience those things. So what are the future plans for that? And then the other part is, what about more LGBTQIA plus trainings with the doctors and other staff at all of the locations and not just this one?
Do you want to take that, Dr. Egan?
Yeah, I will. First off, thank you so much for coming here and finding this space. And if you ever have a less than stellar experience, we actually all want to know about it, because you're right. You should have a stellar experience no matter what the location. Intentionally for Pride Medical, we started here because, and we wanted to improve here because we wanted to get it right before we expanded. So often we have a great idea, we quickly get it out, and then we go, oh, it's looking good, let's spread it everywhere. And we don't do it. First off, there are actually a limited number of LGBTQ plus physicians anyway. But we're going to expand. Speaking of across the river, we would hope to have increase into our Virginia location. I think also our Baltimore area. But we want to get it right here first. And that's why we were also really careful to make sure we had the right physicians in place. And we're now expanding. Some of your colleagues are also joining Pride Medical. So we're increasing. We also really want to make sure that our physicians get WPATH certified as part of this. But to speak more generally, I'm actually going to turn it over to Dr. Jonas, who actually created nationally for us the training.
So I worked closely with Bianca and one of our colleagues from Aaron Waters from another KP region, and we actually created a 1-hour training for both staff in the medical group, so physicians, administrative staff in the medical group, as well as administrative staff and clinical staff in the health plan, that really covers kind of the basics of transgender, non-binary communities, care, really definitions. What do these terms mean? Case profiles, who is, maybe I've never met a trans person and I don't really understand how that looks in everyday life. We have some sort of profiles that have a person explaining kind of their personal journey. It talks about the type of care that these members access, how different people access different types of care. Some people want different services that other people don't necessarily want as part of their journey. So it's really supposed to be kind of a 101 of the trans and non-binary community. And so right now that's available to all of our staff and physicians to take, and we've had quite a lot of staff members take us up on that training, and we've received some positive feedback on it. So, Bianca and I are hoping there'll be a next iteration of this and another one after that, frankly, to kind of keep evolving our staff as we become more expert in this area to make sure that we've got that service piece and that patient experience piece improving. So, thank you.
And I think another way that we've tried to extrapolate this care is with our preferred provider list. Does anyone want to speak on that?
Sure. So while we understand that ideally, we also want people to come here to Pride Medical, we do know also that there aren't, not everyone has easy access. So we are curating, and it's a verb, curating carefully other physicians in not just also primary care, but in other specialties, so that we can make sure that when we, if you're requesting services, whether it be, let's say, Gaithersburg, Largo, Baltimore, or Tysons, we can refer you to physicians who is meeting our standards of care for that. I think it's important to point out that that's available through kp.org and including the kp.org app. So that you can be hooked up to those physicians and request that kind of visit. That's also how you can get hooked up with Pride Medical.
Thank you. All right, another question. Hi, thank you.
George Kerr, and I'm the new community coordinator for the DCCFAR, Center for AIDS Research. And as a long-term survivor of 27 years, what are the areas that you are working with focusing on aging with HIV? There's very little that's being done nationwide right now, and we know that the numbers are growing very quickly.
I guess I'll take that one.
Okay, great.
So first off, you're absolutely right. Aging with HIV is becoming the largest group. We're part of Kaiser Permanente Mid-Atlantic States HIV research is part of a few national consortiums. One's called NA Accord, where we're collecting data on that. That's from making sure we understand the epidemiology, the health services, the quality of life that people are, in Northern California KP and Mid-Atlantic KP contribute to that and are active members of that study. Other areas that we're doing is really looking very closely at what medications patients are taking, making sure careful about drug-drug interactions, making sure good preventive health care of checking for osteoporosis. For example, many of the drugs used in HIV can actually affect bone mass, bone mineral density. We're also looking at mental health, and especially for long-term survivors, we all know that there's been evidence of guilt. Why did I survive and my friends and loved ones didn't? We're also looking closely at neurologic function as you age, specifically onset of dementia or earlier dementia. We know that affects. But I think having a really top-notch HIV clinical staff team is really critical. I'm proud to say that in KP and KP Mass, we've been nationally shown by the National Office of AIDS in both HRSA as well as in the White House. We were designated as an excellent example of multidisciplinary HIV care. But you're right. I think HIV and aging was not two words we thought we'd be using years ago together. But we are now, and we are not here in Mid-Atlantic, but out in our Northern California region, over 50% of our members with HIV are over 50. Here we have, but within KP Mass, we have a slightly younger population, but you're right, that's absolutely growing. So we have to be ready for that care. We have to be conscious of it and really understand what needs to happen. Where we're also looking at that, as I forgot to mention, is KP Mid-Atlantic. We're also part of NIH-sponsored the DC cohort. And that's a consortium and collaboration of the larger HIV programs in the district. And so we're all working on that. And it's a common area of discussion. How is going to care change with aging? And so can I give you one answer today? No. But I think it's going to be something that is acutely being aware of. And I know my colleagues in our HIV programs, we're all very acutely aware of it.
Thank you, Dr. Horberg. It's so impressive how much research we're doing here. All right, any other questions? We answered them all. Great. All right. Okay. Well, thank you so much for joining us this evening. Before we conclude tonight's event, I would like to turn it over to Dr. Sheetal Desai, who is our physician-in-chief for DC Southern Maryland, for some final remarks. And then we will close out our event with an official ribbon-cutting ceremony in celebration of Pride Medical. Thank you, Dr. Desai.
Good evening, everyone. A big round of applause for Dr. Williams, our moderator, and our fantastic panel. So as Dr. Williams mentioned, I'm Sheetal Desai. I'm the physician-in-chief here at Kaiser Permanente. I'm a board-certified family medicine physician, and my pronouns are she, her, and hers. I am so thrilled to have been able to participate in tonight's panel. We're so incredibly grateful to our amazing panelists, our moderator, our colleagues, and our wonderful guests that have attended tonight. And we thank you for such an inspiring and invigorating attendance at tonight's event. I also wanted to take this opportunity to publicly thank the leadership team that was involved in creating Pride Medical here at Capitol Hill Medical Center. It was a large team under the leadership of Dr. Michael Horberg, Dr. Keith Egan, Dr. Cabell Jonas, and many team members and leaders who are here in the room tonight. So our deepest gratitude to this incredible team who was tireless in creating Pride Medical, which opened its doors to our patients in June of 2021. So a huge debt of gratitude to the wonderful team. You heard some of the wonderful services that are provided at Pride Medical for our patients. Primary and gynecological care, transgender patients have a pathway for gender-affirming services. This includes hormone therapy, connecting patients to gender-affirming surgical services, as well as pre- and post-op care, and as well as our behavioral health and mental health offerings. And so at this time, with such a wonderful audience here in place, we wanted to take the opportunity to engage and commemorate Pride Medical with a ribbon-cutting ceremony, which we were not able to do last June related to the pandemic at that time. But with such a wonderful audience here tonight, we wanted to take the opportunity for a ribbon-cutting ceremony with our panelists, with our moderator, and some of our leadership who's here in the room. And so I'm going to invite some of our leaders, Dr. Emmanuel, Dr. Gahunia, Dr. Winston, Susan, Cynthia, Armando, if you could join us at the front of the room, and we will commemorate our fantastic Pride Medical with a ribbon cutting at this time. So thank you.